Now, probably one of the most common occupational injuries that we see in general, and especially up here in Mount Isa, is tennis elbow. So tennis elbow is also known as lateral epicondylitis. And what it is, it's pain in this area of the elbow here. It's caused by an overuse injury, so we're basically overworking the muscles of the forearm extensors. They produce this movement, all right? So lots of spanner work, lots of screwing, just basically overactivation of the wrist here will cause the tendons to become irritated in this area where they attach here, okay? Now there's lots of different things you can do for tennis elbow. Physiotherapy is the first sort of port of call. Loosening off these muscles here will work really well to settle down the tension in the forearm. There's some electrotherapy modalities that we can do around this area here too. And it really depends on what sort of stage of tennis elbow you have. Tennis elbow is a tendon issue, which is known as a tendinopathy. And there's different stages of a tendinopathy. The first stage is you sort of get a reactive sort of inflammatory phase. And generally by settling it down and resting, things will settle down quite quickly. The next stage is sort of the remodeling phase, and then following that we get the chronic phase. And when you go into these later stages, the structure of the tendon has actually changed, and therefore there's some good protocols that we can use to reverse those changes. There's some very good exercises that you can do to reverse those changes. We've also got a really good unit in the clinic here, which is quite rare, which is called shockwave therapy. And shockwave therapy works really well to settle down tennis elbow. But what it does is it basically breaks down the scar tissue in the forearm around the attachment point there, and helps to realign those fibres. And therefore, by using shockwave therapy and other physiotherapy modalities, lots of people with tennis elbow do very well and make a full recovery. It is one of those things that can rear its head again in years to come, and therefore it's important that you settle it down properly the first time. A lot of people will try resting, and if they've had tennis elbow for 6 months and then they rest, it will get better. However, you haven't changed the structure of the tendon, you've just settled it down and rested it, and therefore unfortunately as soon as you get back on the tools or back doing your sport, back in the gym, it usually gets worse again because that structure hasn't changed. So if you're struggling with tennis elbow, you think that's something that you want to find a little bit more about, phone us up at the clinic here in Isa and book an appointment, and we can have a little look for you and see whether there's anything we can do to help.